Hello class, my name is Austin Holmes and I will be doing my presentation on schizophrenia. And I will be covering basic definition, symptoms, causes, treatment that I discovered as well. I hope you guys enjoy it, so let's dive in. So to start, a basic definition for schizophrenia that I found in our textbook was a devastating psychotic disorder that may involve characteristic disturbances in thinking, perception, speech, emotions, and behavior. Schizophrenia is commonly misunderstood. For a long time, I thought that schizophrenia was synonymous with multiple personality disorder. And the reality is that schizophrenia is multifaceted, it's complex. And that is a reason for this common misunderstanding. Not to mention, social media frequently misrepresents this disorder. Another important thing to note as we talk about the basic definition of schizophrenia is that this disorder is not defined by a particular behavior. A lot of the disorders and health issues that we've talked about in this course are defined by what I would call characteristic behaviors. It is a behavior that you could associate directly with the mental health issue. And schizophrenia is not like that. There are many symptoms. There are many different things displayed and aspects of this disorder that are all happening at the same time. And there isn't one behavior that we can directly link with a schizophrenia diagnosis. Now, talking about that, let's move on to symptoms. Some of the symptoms we see in schizophrenics are hallucinations. And when we talk about hallucinations, we're talking about perceptual disturbance in which something is seen, heard, sensed, which is not actually present. Similarly to these, and also a part of the diagnosis for schizophrenia, are delusions. Delusions are strong beliefs that misrepresent reality. Common types of delusions are delusions of grandeur, supposed or perceived importance that isn't actually true, or delusions of persecution, where people suffering from this would believe that others are against them for some reason, when that actually isn't the case. A few other symptoms that are common in schizophrenics are inappropriate affect, emotions or emoting that isn't actually proper for the moment that it's experienced. Another symptom is a deficiency in the amount or content of speech. And I think this is pronounced alogia. Another one, anhedonia, is the presumed lack of pleasure experienced by some people. So this symptom is essentially a lack of pleasure derived from things that others would commonly have pleasurable experiences in, such as sex and eating. The final symptom we'll discuss is analogy commonly used to describe it is the wearing of a mask, and this symptom is called affective flattening. And the basic idea here is that if one were to wear a mask, they could emote, they could display any type of emotion, feel anything, but anyone looking at them would not know it. Affective flattening is a symptom where those suffering from it will not express what they're feeling with their face or body language. Some of the causes for schizophrenia have been linked to genetics. Genes are responsible for schizophrenia vulnerability. There are a lot of studies about that, and we don't understand everything about that. But we do know that we have found some type of link there. There are also psychological causes such as stress, and also social influences, your family, and how you were brought up. Now, the treatment for schizophrenia has varied throughout the years, involving medication to treat the symptoms. Some of the problems with medication have been relapse and inconsistent use and general ineffectiveness. There's also psychosocial intervention, but most fascinating is integrative treatment approach. And part of this treatment approach is collaborative psychopharmacology, assertive community treatment, family psychoeducation, supportive employment, illness management and recovery, and integrated dual disorder treatment. And all of these are fairly involved and have served to be effective in treating schizophrenia. But the important thing to note with this approach is that schizophrenia is recognized as a complex, as a multifaceted disorder, and this treatment approach is effectively saying we're going to recognize that about schizophrenia, and so we're also going to have to treat it similarly in a multifaceted way. Moving on, we get to ethical and legal issues. Now, schizophrenia is defined by a distinct misperception of reality. And part of what that means is that those suffering from it have often been harmful to others and themselves at some times. And, it gets dicey when we're talking about criminal cases involving schizophrenic diagnosis because of the questions that we have to ask involving this disorder. Is it right to legally prosecute someone who couldn't necessarily control their actions? And it's ethically questionable because what we're asking is it right to convict someone and send them to prison when really what they need is treatment for their disorder? It's also important for us to talk about the right that those suffering from schizophrenia have to treatment. That's an ethical issue that we need to continue to bring up. Those suffering from this do need help, and we need to provide it for them. And also, they have a right to refuse that treatment, and to keep that from them is also an ethical problem. In Minnesota, there are a few local options, really, really good options for treatment of schizophrenia. The Mayo Clinic in Rochester was this year awarded with a top rating by the U.S. News and World Report for 2015 and 16 for psychiatrics. And that's right here in Minnesota and available to anyone. The Department of Human Services here in Minnesota offers programs and services by county for a wide range of problems, including psychosis. And we also have that in the University of Minnesota Medical Center. Both the U of M and the Minnesota Department of Human Services offer emergency services for extreme cases of psychosis. And even more locally, here in my community in Wayzata, Psychology Today provides a wide range of resources such as therapists, facilities you could get connected with to help treat psychosis. The BHSI is a clinic very local here in the Twin Cities with 6 locations for outpatient treatment. And I also found this to be very interesting. Dr. Lisa Kelly is offering a support group called Living with Schizophrenia, providing opportunities for those who have been diagnosed with schizophrenia to grow and learn life skills, as well as other therapists. Thank you for listening to my presentation. I hope you enjoyed it. Thanks so much.